Hi, my name is Jennifer Viera, and this is my return demonstration for an intradermal injection. The first thing I'm going to do is perform hand hygiene, and I am going to check the 6 rights of medication, which are the right medication for the right patient, the right dose at the right time, the right route, and the right documentation. Once I have verified that, I'm going to get my supplies. I have alcohol swabs. I have a 1 milliliter syringe with a 27 gauge 1/2 inch needle, and I have my medication vial, which I am going to check the expiration date. I'm going to make sure there aren't any cracks and that there aren't any particles in the medication. And then before I prepare the medication, I will perform the 6 rights again. On a clean surface, I am going to open my syringe, and I'm going to clean the top of my vial. I'm going to remove the cap, and I'm going to draw in 1/10 of a milliliter of air, insert that into the medication vial, and inject the air. Then I will turn it and draw out my 1/10 of a milliliter of medication. Once I have it, I'm going to use the scoop method to recap my syringe, and I'm going to ensure that I have the correct amount of medication. Now I'm ready to see my patient. So when I go to my patient, I am going to verify that I have the correct patient with 2 identifiers. I am going to put on clean gloves, and I am going to check my 6 rights of medication one more time. That is the 3rd check. Now for an intradermal injection, you can use 3 spots. You can use the anterior forearm, the upper chest, or the upper back. I am going to use the anterior forearm. So the first thing I'm going to do is clean the area from the center out in a circular motion, making sure not to touch a cleaned area twice. And we're going to let that dry completely before giving the injection. Then we are going to take our syringe, and we are going to inject it while holding the skin firm at a 5 to 15 degree angle with the bevel up. We are going to inject the medication, and a wheel will form, and then we are going to put the needle directly into the sharps container. Now, if there is anything on the surface, we can blot that, but we are going to be careful not to rub it or apply a bandage. And then we are going to draw a 1-inch circle around the area so that it can be rechecked. And then we are going to make sure that it gets documented correctly. Thank you.